Hi, welcome to KXAN Plus. I'm your host, Esmeralda Zamora, and we have our Simple Health episode today where we are going to break some health topics down. And with me is our health expert, Jose Torres. Jose, thank you for joining me. How you doing?
I'm doing great, Esme. Thank you again for having me here.
It is not Monday while we're recording this, but it feels like a Monday, don't you think?
Yeah.
Before we get into this fun topic or this important topic, can you please explain to us what simple health is and why we cover simple health here at KXAN?
Yeah, there are so many untold stories here in Austin and the Central Texas area regarding medical health research. And so, what we want to do is empower you with information because there might be a chance that you or a loved one is struggling, facing a health challenge, whether it be cancer or maybe diabetes. And so, we've covered things of new treatments regarding diabetes and cancer, and also new HIV treatment. So, what we try to do is simplify all of that for you and make it easy for you to digest. We bring in experts. And so, telling you the untold stories here in the medical field about here in Austin.
Yeah, and we usually have some experts here sometimes that we interview, or even patients that go
Mhm.
through certain situations and explain to us how it went or how they're doing now. So it's important to talk about these things.
Yeah, and to give you some hope, especially if you're a loved one dealing with something like that.
Yeah, and I'm sorry I did start this stream by saying a fun topic. It is not a fun topic. It is actually a sad topic. We were talking about the death of James Vanderbeek, who recently passed this year. Jose, what was the reason for his passing?
Uh, the young actor that we all know, probably from the late '90s of Dawson's Creek. I don't know if you watched that.
Yeah, and there's a clip of it too.
You might have been a little bit too young.
It came out the year before I was born.
Oh, okay, gosh, okay. Well, I was in my early 20s. Okay, well, the 48, he died at the age of 48, and after a few years of battling colorectal cancer, he moved to Austin from California back in 2020. He and his family lived in a ranch in Spicewood, which is near here, near the Austin area. And just recently, our Will Dupree, he spoke with James Vanderbeek back in December to talk about his diagnosis and raising awareness about this cancer. And here's what he told Will.
I scheduled my colonoscopy and turned out even though I was in amazing cardiovascular shape, I was trying to eat as healthy as I could, or felt like eating at the time at least. Um, I was biohacking, I was doing all the austenite, the cold plunge sauna, all that kind of stuff. And I had stage 3 cancer. I had no idea. 1 in 3 Americans who are of the screening age, which is 45, have not been screened. And I just saw a stat that only 32% of Texans who are of the screening age have been screened for colorectal cancer. So it's the second deadliest if you don't catch it early, and it's the most curable if you do.
Yeah, he is survived by his wife and
My
6
dad was
children.
playing minor league
And his
baseball.
kiddos, right?
Yeah, yeah. If you follow his social media pages on Instagram, yeah, he has several pictures of him and his kids and his wife.
And Jose, in one of those social media videos that you're talking about, he spoke about Guardian, and that this is something that you have covered in the past. We've discussed it here on KXAN Plus, but for those of our viewers who don't know what Guardian is, what is it?
So it's a blood test. It's the drug maker is Guardian, and it's the name of the blood test is called Shield. And so James Vanderbeek was a big advocate for this blood test. The reason why is because it's a blood test, and for those people who are maybe not sure that they want to go through the colonoscopy procedure, this is another way, an alternative to get that procedure, that screening done. It's less invasive, and it's done through a blood test, and it examines a person's DNA. So the FDA approved this procedure back in 2024, and research published about this says that the test caught 83% of cancer. So health experts hope it will help people encourage people to get tested and catch the cancer early. I spoke with a doctor out of Leander. He offers this test to his patients. He says some 50 million Americans are recommended to, sorry, let me start over. He says some 50 million Americans at the recommended age to get screened for it don't get tested. So he and other doctors stress that this is not a replacement for a colonoscopy, but here's why, and he explains his thought behind that.
We're trying not to replace the colonoscopy. That is our gold standard, but we're trying to bridge the gap between those who don't want to get tested at all and are just really scared of their limited options.
Jose, you also spoke with a cancer survivor who wished this option existed when doctors diagnosed her at stage 3 colon cancer more than 10 years ago. What was the experience like for her before all of this existed?
Yeah, she would, yeah, it's still, even though she is now cancer free, almost 12 years later, she still gets choked up a little bit about it. During our conversation last year, it brought up a lot of emotions about her treatment and that journey. But now she is wanting to raise awareness about getting tested and the resources that are available out there. Here's what she told me about it.
Knowing that there's so many other people out there living with the same disease and knowing the stigma behind not wanting to talk about it is what prevents people from prevention.
That it's tough when you're going through something and then later you see that there's so many more options or ways that you could have stopped or caught your situation earlier. Um, what is next for Guardian? Is there any updates regarding this test?
The goal is to make it more accessible to more people because in the beginning, only people with Medicare were able to get this test. So the goal is to get more people and also at a younger age to get tested because a lot
That
of us,
it's changing, right? The requirement or the age of when to get tested for colon cancer?
yeah, and the reason behind that is because people under the age of 50 are starting to get cancer, colorectal cancer
Colorectal cancer.
diagnosis. So the story here is to get tested no matter what your age, especially if there is cancer running in your family. You definitely want to talk to your doctor about that. And let me just go over some warning signs. According to the American Cancer Society, things to watch out for: a change in bowel movements, diarrhea, constipation, the narrowing of the blood stool. If it lasts for more than a few days, because sometimes things like this can happen.
Here and
it'll
there, yeah.
and it'll last for maybe 3 days, or maybe you have a stomach flu or something like that. But if it lasts for a long period of time, for more than a week, it's best to talk to your doctor and keep that communication open, and you can go from there. Also, another thing to watch out for: a feeling that you need to have a bowel movement that is not relieved by having one. Rectal bleeding with a bright red color, blood in the stool, which may make it look a little dark or black, cramping or abdominal pain in your stomach, weakness and fatigue. And sometimes people think, oh, I've just been working too hard, or
Yeah,
I've been
stress,
right.
something.
But if it lingers for more than a few days consecutively, definitely talk to your doctor about it. Losing weight without you trying to lose weight, that is another key factor to look for.
You may think it's a great thing, but it may not always be, right?
Right. My mom found out she had stomach cancer because for like a couple of weeks she noticed this abdominal pain in her stomach, and at first she's 75 years old, so they thought, oh, it might be this thing. It might be gastritis.
Gastritis.
But it lingered, and so she was listening to her body, and she talked to her doctor, primary doctor, and then from there we went on to get screened for cancer, and we found out it is cancer. And so just listen to your body. take note of all these things that are happening, changes in your body. And if it lingers on, you definitely want to talk to your doctor. And then it may even be helpful to write these down on like a notepad, just so you can offer that data to your doctor, because
Yeah.
that data will be very helpful.
Yeah, there's a lot of times where I go to the doctor for whatever reason and they're asking me, well, when did this start? And I don't remember. I'll say like 3, maybe 4 days ago. Maybe it was actually a week ago. So jotting down the time and the date of when you're noticing these things can probably save your life, right?
Definitely. And then, early detection is key, as we hear all the time regarding cancer or any other illness.
Yeah.
If we do have this story from last year, I think if you can pull it up for me. So if you scroll down, you'll see a photo slideshow from Anne's Story's part of the story that her last name is Story, but and I just said Story. But Anne's Story's story, and so there's a link there to this annual run. It's called Get Your
Rearing gear.
Get Your Rear in Gear. Yes, and it's a fun run, and it's also like a support group for people who maybe having have colon cancer, or maybe they have a loved one with it, and so they raise funds through this event, and it's every year, and it's coming up in the beginning of March. So you can click on this story on our Simple Health page to learn more about this. Get Your Rear in Gear, and and it's also a way to find a community that could understand your journey better. And like I say, community keeps the heart beating.
Yes.
And so that is something, to lean on. Even it's hard sometimes.
Yeah, there's even a link here to some guidelines from the American Cancer Society that may be helpful to just save on your phone and just keep it there so that you can always reference it in case you're ever worried, right?
Yeah, definitely. And there's other details there about the blood test. So that, if you want to learn more about that, we have that for you there.
Yeah, and it's on our website, KXAN.com. Jose, thank you for joining me. It's always nice to chat with you and learn something new. I've been hearing a lot about colorectal cancer recently. It seems to be popping up frequently, and a lot of individuals are getting it more and more than it used to be.
Yeah.
And it's awesome to see someone like James advocate for it so much and explain the importance of getting tested early and knowing the signs and the symptoms as well.
Yeah, definitely an important topic for sure.
Thank you so much for joining me, Jose, and we'll see you next week.
Sounds good.